Mr. Speaker, this morning I had meetings with ministerial colleagues and others, and in addition to my duties in this House, I shall have further such meetings later today.
We now head to South West Devon with Sir Gurry Street. Sir Gurry.
Thank you, Mr. Speaker, and I know the whole House will want to associate itself with the Prime Minister's remarks about our dear Brian Binley. Mr. Speaker, one of the groups hit hardest by the pandemic is young people in full-time education, especially those facing exams last year and this, with all of the mental health challenges that come from such uncertainty. Does my right honourable friend agree that those for whom exams have been scrapped this year would now benefit from the utmost clarity about how exactly they will be assessed? A clear plan, announced early, without last-minute changes, to help teachers and students prepare for an even more challenging experience. Thank you.
Well, my right honourable friend is absolutely right, and there is clearly a problem of differential learning that has grown over the last few months and risks being exacerbated now by the current lockdown, and we'll do everything we can to ensure that exams are fair, that the ways of testing are set out in a timely way, and the Department for Education is launching a consultation with Ofqual to ensure that we get the right arrangements for this year.
We now come to the Leader of the Opposition, Right Honourable Keir Starmer.
Thank you, Mr. Speaker. Can I join the condolences expressed by the Prime Minister, I'm sure, on behalf of the whole of the House? Can I also, Mr. Speaker, begin by paying tribute to all of those involved in the vaccine programme? I went to the Newham vaccine hub last week, and it was really uplifting to see the NHS, the Red Cross and lots of volunteers all working together and giving real hope. They had a simple message to me, which is if they had more vaccine, they could and they would do more, and I'm sure that's shared across the country. I welcome news that's come out this morning about a pilot of 24/7 vaccine centres. I anticipate there's going to be huge clamour for this. So can the Prime Minister tell us, when will the 24/7 vaccine centres be open to the public, because I understand they're not at the moment, and when will they be rolled out across the country?
Well, I'm grateful to the right honourable gentleman for what he says about the rollout of vaccines, and I can tell him that we'll be going to 24/7 as soon as we can, and my right friend, the Health Secretary, will be setting out more about that in due course. And as he rightly says, at the moment the limit is on supply. We have a huge network, 233 hospitals, 1,000 GP surgeries, 200 pharmacies and 50 mass vaccination centres, and they are going, as he has seen himself, exceptionally fast. I pay tribute to their work, and it's thanks to the work of the NHS and to the Vaccine Task Force that we have secured more doses, I think, per capita than virtually any other country in the world, certainly more than any other country in Europe.
Keir Starmer.
Thank you, Mr. Speaker. I obviously welcome that and urge the Prime Minister and the Government to get on with this. We're all happy to help, and there are many volunteers who are. The sooner we have 24/7 vaccine centres, the better for our NHS and the better for our economy. Mr. Speaker, the last PMQs was on the 16th of December. The Prime Minister told us then that we were seeing, in his words, a significant reduction in the virus. He told us then that there was no need for endless lockdowns and no need to change the rules about Christmas mixing. Since then, since that last PMQs, 17,000 people have died of COVID. 60,000 people have been admitted to hospital, and there's been over 1 million new cases. How did the Prime Minister get it so wrong, and why was he so slow to act?
Well, Mr. Speaker, of course, what he fails to point out is that on the 18th of December, 2 days later, the government was informed of the spread of the new variant, and the fact that it spreads roughly 50 to 70% faster than the old variant, and that is why it is indeed correct to say that the situation today is very troubling indeed. We have 32,000 COVID patients in hospital. The NHS is under huge strain. And Mr. Speaker, I would like to take this opportunity to pay tribute to all the staff, the doctors, the nurses, everybody working now in our NHS who are doing an extraordinary job under the most challenging possible circumstances to help those who so desperately need it. And I thank them for what they are doing. But at the same time, I also want to thank all those involved in what is the biggest vaccination programme in the history of this country, where once again the NHS is in the lead, working with the Army and the Legion of volunteers and everybody else. And that programme of vaccines, Mr. Speaker, does show the way forward. It does show how we're going to come through this pandemic. And again, I repeat my gratitude to all those involved, because they've now vaccinated 2.4 million people, delivered 2.8 million doses, more than any other country in Europe. This is the toughest of times, Mr. Speaker, but we can see the way forward.
Mr. Speaker, the Prime Minister says that effectively 2 days after that PMQs, the advice changed. The truth is, the indicators were all in the wrong direction back at the last PMQs. But be that as it may, the Prime Minister says he got that advice on the 18th of December, 2 days after PMQs. And we've all seen the Sage minutes of the 22nd of December confirming the advice that was given to the government. The government's advisers warned the Prime Minister that the new variant was spreading fast and it was highly unlikely that November-style lockdowns would be sufficient to control it. Pretty clear advice on the 18th of December to the Prime Minister from Sage. Tougher lockdown than November is going to be needed. I've got the minutes here, everybody's seen them. Yet instead of acting on the 18th of December, the Prime Minister sat on his hands for over 2 weeks. We're now seeing in the daily figures the tragic consequences of that delay. So how does the Prime Minister justify delaying for 17 days after he got that advice on the 18th of December?
Well, Mr. Speaker, I must disagree very profoundly with what the right honourable gentleman just said, because he knows very well that within 24 hours of getting the advice on the 18th about the spread of the new variant, we acted to put the vast part of the country into much, much tougher measures. And indeed, what we are now seeing, and it's very, very important to stress that these are early days, we are now seeing the beginnings of some signs that is starting to have an effect in many parts of the country, but by no means everywhere. And it is early days, Mr. Speaker, and people must keep their discipline, keep enforcing the rules, and work together, as I've said, to roll out that vaccine programme. But, Mr. Speaker, I do recall that on the day that we went into a national lockdown, and sadly we were obliged to shut the schools, even on that day, the Labour Party was advocating keeping schools open for understandable reasons, Mr. Speaker, because we all want to keep schools open, but I think it a bit much to be attacked for taking tougher measures to put this country into the protective measures it needed when the Labour Party were themselves calling then to keep schools open.
Mr. Speaker, just for the record, I wrote to the Prime Minister on the 22nd of December. I hadn't seen the Sage advice at that stage, saying to him, if it indicated there should be a national lockdown, he should do it immediately and he'd have our full support. I'll put that in the public domain so people can just check the record. But, Mr. Speaker, more fundamentally, the Prime Minister says we took measures straight away, we put people into different tiers. The advice was a November-style lockdown is not enough. How on earth was putting people into a different tiered system an answer to the advice that was given? And isn't this the situation that every time there's a big decision to take, the Prime Minister gets there late? The next big decision is obvious. The current restrictions are not strong enough to control the virus. Stronger restrictions are needed. And it's no point members opposite shaking their heads. In a week or two, the Prime Minister is likely to be asking members to vote for this. So can the Prime Minister tell us, when infection rates are much higher than last March, when hospital admissions are much higher than last March, when death rates are much higher than last March, why on earth are restrictions weaker than last March?
Mr. Speaker, we keep things under a constant review, and we will continue to do so. And certainly, if there is any need to toughen up restrictions, which I don't rule out, Mr. Speaker, we will of course come to this House. But perhaps, as is so often the case, the right honourable gentleman didn't listen to my earlier answer. Because I pointed out to the House that actually the lockdown measures that we had in place, combined with the Tier 4 measures that we were using, are starting to show signs of some effect, and we must take account of that too, Mr. Speaker, because nobody can doubt the serious damage that is done by lockdowns to people's mental health, to jobs, to livelihoods as well. And Mr. Speaker, if to listen to the right honourable gentleman over the last 12 months, you'd think he had absolutely no other policy except to plunge this country into 12 months of lockdown. And as for coming too late to things, Mr. Speaker, I think it was only a few weeks ago that he was attacking the vaccine task force that has secured the very doses, the millions of doses that have put this country into the comparatively favourable position that we now find ourselves.
It's just not true. Every time I've spoken about the vaccine, I've supported it. But the Prime Minister says we're balancing health restrictions and the economy. And yet we ended 2020 with the highest death toll in Europe and the deepest recession in any major economy. So that just isn't a good enough answer. Mr. Speaker, I want to turn to the latest free school meals scandal. We've all seen images on social media of disgraceful food parcels for children, costed at about £5 each. That's not what the government promised. It's nowhere near enough. So can I ask the Prime Minister, would he be happy with his kids living on that? And if not, why is he happy for other people's kids to do so?
Well, Mr. Speaker, I don't think anybody in this House is happy with the disgraceful images that we've seen of the food parcels that have been offered. They are appalling. They're an insult to the families that have received them. And I'm grateful, by the way, to Marcus Rashford, who highlighted the issue and is doing quite an effective job by comparison with the right honourable gentleman in holding the government to account for these issues. And the company in question has rightly apologised and agreed to reimburse. But it is because we want to see our kids properly fed throughout this very difficult pandemic that we've massively increased the value of what we're providing. Another £170 million in the COVID winter grant scheme. £220 million more for the holiday activities and food programme, and we're now rolling out the national free school meal voucher scheme, as we did in March, to give parents the choice to give kids the food that they need. Under this government, we will do everything we can to ensure that no child goes hungry as a result of the privations caused by this pandemic.
Keir Starmer.
Mr. Speaker, the Prime Minister says that the parcels are disgraceful, but it shouldn't have taken social media to shame the Prime Minister into action. Like the Education Secretary, he blames others, and he invites me to hold him to account. So let me do that. Because blaming others, Prime Minister, it's not as simple as that, is it? Because I've checked the government guidance on free school meals, the current guidance, published by the Department of Education. I've got it here. It sets out example parcel for one child for 5 days. Department of Education, Prime Minister, you want to be held to account. 1 loaf of bread, 2 baked potatoes, block of cheese, baked beans, 3 individual yoghurts. Sound familiar? That's the images, Prime Minister, you just called disgraceful. The only difference I can see in this list and what the Prime Minister has described as disgraceful is a tin of sweet corn, a packet of ham and a bottle of milk. So he blames others. But this is on his watch. The truth is, families come last under this government, whether it's exams, free school meals or childcare. Will the Prime Minister undertake, he wants to be held to account, to take down this guidance by the close of play today and ensure that all of our children can get a decent meal during the pandemic?
Minister.
Speaker, the right honourable gentleman's words would be less hypocritical and absurd if it were not for the fact that the